What's good, everyone? This is Dr. Nee Darko. Make sure you hit the subscribe button below so that you're always up to date on the new uploads as well as alerts on this show. The other thing that you can do to help build this community is make sure you leave a comment below. Let us know what you like, what you don't like about the show, and ultimately, let us know who's winning these arguments, because I need to know that I'm beating Renee in these debates. Run the tape. Yo, what's up, everybody? This is Dr. Nee. I'm joined by Dr. Renee and the rest of the Docs Outside the Box team, my superheroes. I got Audrey all the way from Kenya, and I got Kiara all the way from North Kakalaka. Welcome to another episode of Docs Outside the Box, y'all.
Yeah.
Let's jump into this because I am tired. I'm coming in off of night shift. I'm purely running on steam. And the whole night, Renee, while I'm doing my notes, I'm listening to Kendrick Lamar's GNX album because it be like that. And sometimes when you are tired and you need some fuel, that album gets me through the night. I love that album. So
Excellent. Well, let's hurry up because I got a meeting with a pre-med.
Oh, my goodness. Okay.
Yes.
All right. So, Kiara, what is the question that we have for today?
All right, so this one is about health insurance and retirement plans on locums.
Ooh.
And it's
Who's it from?
froze on me.
It's very apropos, too.
It froze on me. Hold on.
Very apropos. This is the beginning of the year.
It's from Josephine.
Yay.
And she said, a friend of mine just shared with me one of your videos where you talk about how awesome it's been doing locums. I just love that. I'm a second-year medical student, and have always wanted to go into OB. I'm all about the work-life balance, and I think locums would give an opportunity for just that. I just have one question, though. How do you navigate the health insurance and retirement plan component? I'm not sure if locums provides that.
Yo, I'll be really honest.
Josephine, for the
I'll
question.
be really honest. Josephine, thank you for submitting that. But I've been really interested in the comments that we've been getting about locums from medical students. Have y'all noticed that? Like, we've gotten questions from people who, like, they still have several years before they have to even start worrying about locums, right? Because for the medical students, if you're wondering, like, locums is not until you finish residency and you are working on your own, right? Once you start working on your own, then you start considering locums, right? There's some small caveats, but just for the sake of this convo, it's when you finish. And I think what you're starting to see is a lot of people are starting to realize, hey, like, this is a lifestyle that I want to think about, or this is a lifestyle that interests me, despite all the noise that I got to worry about with studying, with taking boards, with getting through rotations. This is just a lifestyle that I want. I have on my service right now, I have a medical student who's applying for medical school, applying for residency right now. He's doing his interviews right now. He wants to go into trauma critical care. And I was telling him, I was like, I really like my job because I like the operations that I do. I like the patient that I get to see. But the way in which I jump in and jump out, the lifestyle, like, you can't beat that. And I think you don't really see that in many other specialties in the surgical fields. Whereas trauma critical care, it's very much like lifestyle oriented. And it's really hard when you're in, like, you're very focused and then you can step out. And he said, yeah, like, I really enjoy that. I'm very interested in chatting with you about that in the future. I was like, okay, but I'm like, that's another thing. That's like a fourth-year medical student who's interested in that. So good question. And it's very apropos right now, right? So we're recording this in January. We just re-upped our 1-year subscription for health insurance in the state of New Jersey. So we get our health insurance through healthcare.gov, or we get it through quote-unquote Obamacare, the marketplace, the Affordable Care Act. And we've been getting our insurance through there since 2017. So we go online and we fill in some information. It's really quick. You just go to healthcare.gov. Alfred, if you can put that in there. And when we go to healthcare.gov, you go specifically to the state that you live in. And you, in essence, just start shopping for a different type of healthcare insurance that you need. And it's based off of how many people you need to get covered. So for us, our family, I have to find coverage for Renee, me, as well as 2 kids. And you just get to shop. You literally get to look at like a bronze plan, you get to look at a silver plan, and you get to look at a gold plan. And you get to basically like just compare and contrast them between all the different companies that are selling health insurance in the state of New Jersey. You get to look at that through the website. Sometimes it can be a little bit overwhelming, but yeah, that's how we do it. But when you do locums, when you work as an independent contractor, your health insurance is not covered. Your retirement plan, like there is no such thing as that. You work and you get paid, and then that's it. And then you have to take that monies and purchase those benefits that you would normally get if you were employed.
Right.
How'd I
And
do,
then
Renee? Did I explain it right?
yeah, no, that's good. That's good.
Yeah.
And then that money is actually now, well, that money is now tax deductible, correct?
Yes, it is. Yeah, because that's the cost of doing
Right.
business. The cost
Right.
of you doing business as an independent contractor is not just you being at work, going to work, but it's also running your work, which is you need health insurance. So that's tax
Right.
deductible. You need a cell phone plan,
So,
stuff like that.
right. So if you're a med student and you're not quite business savvy yet, you don't quite understand what that means. When people say tax deductible, you know that it sounds good, but you don't quite know exactly what it means. So as a locums, right, when you work as locums, when you get your check, right, from whatever hospital that you're going to be working at, you don't have taxes taken out of that check, right? So if you've worked before, you know that FICA comes after you. You got to
Who's
make
FICA?
contributions. Exactly. You got to make contributions to the government, Medicare, Medicaid, all that kind of stuff. So you know that you are going to have taxes taken out. Well, when you're locums, you're not employed by anybody but yourself, right? You yourself are the business. So you contract out and the hospital cuts you a check with no taxes taken out. Well, even though taxes aren't taken out, that means later on that you do have to pay taxes. So the question is, well, what are you going to pay taxes on? You don't have to pay taxes on that whole check. What you pay taxes on is anything that you didn't use for running the business. So if you buy health insurance is the cost of you doing business. So you're going to take a portion of that money and pay for your health insurance. So when you pay for your health insurance, that money, because it hasn't had tax taken out of it yet, that money is tax free and you pay your health insurance with tax free money. So that's what that means. And, we're going to talk about this so many times over the course of the podcast. So if you didn't get it today, don't worry. Just keep listening to our episodes. You will eventually get it.
Remember we covered this about several months ago. There was an article by that urologist who says he works half of the year and makes a significant amount of money. He makes like
Yes.
400K as a
Yes.
urologist being a locums doc. And like the number is astounding considering the amount of time that he's putting in, right? That's great. But if you go to the bottom of his article, if you pay attention to what he says, in there it says, just so you know, me working this way is cheaper for the hospital, actually. So one thing that a lot of people don't know is that when you're employed, you actually cost the hospital more money versus when you work in a locums independent contracting fashion.
Right.
Do you want to explain why, Renee, or you want me to? But I know that's one
Yeah,
thing that
go ahead.
that's one thing that a lot of people who I think are trying to negotiate with the hospital, they get talked out of by the hospital. They're like, oh, why
Yeah.
don't you just come on as an employee? Let's
It's
say
cheaper
you're
for
a
us,
doctor.
blah, blah, blah.
Let's say you're a doctor. Yeah, they always say that. Like, let's say you're a doctor and you're trying to work at a hospital. Like, they're always going to try to get you as an employee, right? But actually, you are costing the hospital less. And
As an independent contractor. Yeah.
outside of the people who usually are trying to convince you, which could be like a chief medical officer or maybe a department head, like a department chairperson who doesn't understand the numbers and doesn't understand human resources. And that's no shade, but they just don't understand that part. You actually are cheaper when you work as an independent contractor. And the reason why is when you get your salary, like your salary as an employee is not just the salary it costs to pay you to work, but it also includes you needing to get disability insurance, you needing to get health insurance. Like the hospital has to pay a portion of your health insurance, right? So you have to pay a portion of your health insurance as a premium, but the hospital is also covering a portion of that also, right?
Mm-hmm.
To get your retirement plan, like they have to put in money into the retirement plan. To get continuous medical education. Like I can go through the whole slew of things that a hospital gives you as part of its benefits. That
Right.
costs the hospital money,
Money.
right?
Yep.
But when you work as a locums, they ain't got to pay any of that stuff. They just
Right.
got to pay you to work. And when you come and work and then you get a check, you have to use your own money to purchase all those things that you would have gotten if you were an employee. So
Absolutely.
what I end up finding out is, for me, when you boil it down apples to apples, what really I end up seeing the hospitals really saying is listen, as a locums, you are not predictable in terms of when you are going to work,
Mm-hmm.
right? That's how to me, I look at it. And we need predictability,
Mm-hmm.
right?
And that
Like
trumps everything.
that trumps everything. So you showing up on a month to month basis, like you could just bust out and be like, yo, I'm not coming in. And they can't do anything
Mm-hmm.
about it. And that's where they're very vulnerable. And I think that's the part that really drives hospitals nuts. They will say that the variable cost is variable cost of doing locums. That's
Mm-hmm.
expensive. I get all that. But I think
Yeah.
truly what it boils down to is, yo, I need someone to be on a schedule 6 months from now. And I don't have time for them to be like,
Yeah.
yo, I'm in
And
Cancun and I
there's a
can't do
very
anything about it.
easy fix to that, but I'm not going to get into that today. But the easy fix that I'm thinking about, if you've listened to our episodes in the past, is essentially what we did for this OB department, that we essentially staffed the entire call schedule. And I think it's as easy as that, but I won't get into that today. There was the other part of her question, Josephine's question, um, about the retirement. How do you plan for retirement, right? Because usually people think, oh, well, you get retirement through your job. And there are lots of different ways, to get retirement funds and save for retirement or invest for retirement without necessarily being employed. So, Nee, you're better at that, at those explanations than I am. So I'll let you bust that out
Give me the
because I got about
handoff,
5 minutes.
the track and field
Yeah.
handoff.
I got about
Boom.
5 minutes before I got to talk to my pre-med. So,
Yo, tell your pre-med to wait. They can wait. They're not in school yet.
well, they probably in college, Nee.
You know what I'm saying? Like they got
They
time.
got things to do
They got
too.
time. Tell them you recording.
Okay.
We got
They
time.
got things
Okay.
to
We try
do.
to help. We trying to help the greater good.
Okay.
So, but okay, guys. So a retirement plan.
They are part of the greater good, though.
What you going?
Exactly.
It's the truth though, y'all. But like, so your company, you yourself as a locums doc, you need the benefit of a retirement plan. Like you have to have something that's going to help you put money away so that when you reach a certain age, you can use that money to go and live on a boat and go wherever you want to go when you don't want to work anymore, right? That's the retirement plan. So you as an independent contractor, you can purchase that. And you can purchase that through so many different places. But you basically purchase this benefit and you get access, in essence, to the ability to put money away. And when you put money away, that gets treated a certain way by the IRS, right? You get certain tax benefits to do that, right? It decreases the amount of taxes that the government can tax you on right now, right?
Mm-hmm.
So yeah, like there are, and in what that does in essence, it gives you a benefit, right? So we've done that in various ways. Like when I first started doing locums, 12 years ago, man, those numbers, the double digits now.
Mm-hmm.
Yeah, we getting up there. You getting up there, yo. So
Why does
yeah,
it always come to me?
because men age like a fine wine. You know what I'm saying? You ever notice that,
Really?
guy? You ever notice that, ladies? Like
In order
we
for that
just
to
get
be
better,
fine wine, you got to
huh?
stomp them grapes. So don't get stomped, me. Okay.
Wait, hold on. First of all, he said they age like fine wine. Let's just talk about the fact that he lost all his hair.
Okay. Thank you.
I am willing to say that I actually look better without hair than I did with hair.
You know what? I will not disagree because I've seen the
Yes.
pictures.
Yes.
But What I will say is that, sure, men up until a
Tiara's
certain
fired,
point,
guys.
y'all age. Okay. Well, good luck.
Exactly. Good luck.
Up until a certain point, though, men do age fairly well. And then there's, I don't know what it is, right around 50-ish, it's like, doop, fall right off the
No,
cliff.
no. So then explain y'all then, real quick. I know Renee has to go, but explain y'all. What happens after, what happens?
Look at this.
I don't know, because have you seen what 50 be looking like now for women? Have you seen what the grandmas be looking like now? Grandmas don't be looking like grandmas.
Exactly. Hurry up.
I'm not going to step into that. I'm not going to step into that. But I will say this, y'all. Like, a lot of this stuff, though, it seems like it's like, man, like I didn't sign up for this. Like, I already got like all this stuff I got to work on as a doc, as a as a resident, or someone who's just coming right out. Like, it's just too much. But you can do this. Like, a lot of people are doing this, and there's a little bit of a learning curve. But when I first started, I just had like a regular like IRA, right? That's an individual retirement plan, or a SEP, right? Self-employed pension plan. Very simple. And we did that for several years. And then eventually we were like, look, like we do locums for a consistent period of time. We see ourselves 10 years from now doing it. So we upgraded our plan, which is an option, right? It's almost like how when we're looking for health insurance, like there's a gold, silver, and bronze, the same type of thing. We found something a bit more comprehensive, and then we transitioned into that.
Mm-hmm.
But y'all, that took several years, and then we finally got into it. We made mistakes, and we that's how we do it now. And we have money, like we even have it to the point where we were able to take a 401k loan to help, us purchase something, a big purchase, over the last couple of years. All right. So like it's for us now, like we are at a mature level of ours. But I just want y'all to know, Josephine, that is an option that is available for you. And I highly encourage you, whether you put $50 away a month or however you want to put away, like you can do that. And that's the best part, I think, of locums is there's a certain level of independence that you get to practice that I think, people love. It's just like,
Yeah, we're going to be, this is a really appropriate question because we're going to be talking a little bit about this in our course, because that's one of the things. Yeah, just a little bit because we're not financial advisors, but we will be talking about retirement plans. We will be talking about health insurance plans. We'll be talking about, how you get malpractice insurance, all the things that potentially make people have a little bit of the heebie-jeebies about doing locums, right? These are the things that people worry about, right? About doing locums. How am I going to get my health insurance? How am I going to get malpractice? How am I going to get, all these different things, retirement plans. So we'll be talking about this in our course. So if you haven't already signed up for notice about our course, I want you to go to the show notes. And in the show notes, you're going to see a link for a freebie. Once you sign up for that freebie, you're going to be on the list so that when we are ready to announce that the course is accepting registrants, then you'll be notified. It's going to be limited seats. So if you're going to be interested in signing up for the course, make sure you do that as soon as we send out the notice. But that was a great question, Josephine. Thank you so much. And if anybody has any other questions, you can go to the show notes and you can either text us or you can do that. What's it called? Is there a link down there that says, tell us what you think, or text us or whatever?
Yeah. This fan mail. Just click on that link.
It's called the fan mail thing.
We also have the form. We can add the form to that.
Yeah.
To the show notes as well.
So you can do that. You can DM us on Instagram. So just however you feel most comfortable. Just
let me
send
know,
us
guys.
A message.
We want to know.
Go to the website.
Guys, we want to know what you think about GNX. Do you want me to do a future episode on a review on Kendrick Lamar's GNX? That's a question I want y'all to answer for me. Boom.
Why?
Well, before we deviate a little too far,
Yeah.
I know Renee has to go, so feel free to go handle your business.
Yeah,
I'm going to
thank you.
circle knee back to
GNX.
not GNX.
Nobody cares.